Hello, everyone. My name is Christine Pagano, and I think I'm interested more in clinical social work because of some of the situations and work experiences I have had. For 5 years, I worked at a children's hospital that services the Intermountain West, and I worked in the trauma unit. So that was both the operating room in trauma and then also in the ER. And I really enjoyed working hand in hand with the social workers who could kind of dumb down the medical terminology and the sensitivity of our work for the families in a way that they could understand it and really just bring that empathy to the situation, because as we were working to save the child's life or to stabilize that child, we're not necessarily polite to the family. We're not taking time to address their concerns. We're not making sure their needs are met because their child is the most important thing in that moment. So working with those clinical social workers in the hospital has been really beneficial, and I have seen that firsthand. Another aspect of clinical social work that I'm really interested in is therapy, specifically for sexual assault survivors or those struggling with PTSD, and also trauma therapy as well. Things that I would need to do to prepare myself to be a clinical social worker is obviously to understand how to become licensed in the state in which I plan to practice. Each state is a little different, and that licensure practice would be different in each state. So understanding the needs to be licensed and to be competent is obviously very critical, as well as finding internships now that are more clinically based would be helpful as well, and educating myself on that population that I plan to work with. So for example, if I wanted to do clinical social work in hospitals, it'd be beneficial to educate myself more on medical terminology and hospital protocol and procedures and things like that, so that I would be able to explain that better to the families involved. Another thing that I could do when doing therapy is to educate myself on therapeutic practices. So maybe that would involve maybe doing EMDR therapy and understanding that modality and when it's beneficial and when it is not beneficial to a client and to their healing process. I've really enjoyed this class, and I'm looking forward to watching all of your videos. Thanks.